Good day and welcome. My name is Russell Hendrickson. I'm the CEO with Practical Data Solutions. Thank you for joining us for today's webinar, Optimizing Ophthalmology Practice Performance from Data to Insights. And I'm pleased to have joining me today Scott Everett, who's our Vice President of Healthcare Solutions.
Thanks for joining us today, everybody. I appreciate your time. For those of you who are not familiar with PDS, we specialize in healthcare analytics, working with data warehousing, data visualizations, reporting technology, and automation platforms.
At any point today, please feel free to chat in your questions and we'll answer them as the webinar goes along. In today's webinar, we have 5 key learning objectives. We're going to talk about the cornerstones of ophthalmology performance. We're going to talk about identifying and monitoring some of those customized KPIs. We'll talk about communicating effectively with visual dashboards and how to use them to drive focused performance improvements. And overall, talk about strategic planning and where analytical tools take place in that organizational performance excellence.
One of the things we found as we work with a number of clients across the country is that what comes out of the billing system a lot of times is really just very generic and works for a number of different specialties that are out there. But when we start looking at specialized metrics, particularly with ophthalmology, we find that canned stuff just doesn't work anymore. There's a lot of customized KPIs that really need to come into play. Of course, we want to look at the financial type information, but we also may want to look at what's going on with our retail performance, where we're looking at the prescriptions that we're doing with our corrective lenses, with our eyeglasses, what's being sold, as well as what about our elective procedures or cosmetic procedures that are being done as well. A lot of times those aren't found within the system, and we probably want to have that information available to executives.
And so throughout today's webinar, as we highlight different areas of financial, operational, clinical performance, we're going to be highlighting what some of those best practice metrics are that we've been able to help ophthalmology organizations with. And you really want to be thinking about measuring and managing, which you may not be. So let's jump right in. Today, we're going to really leverage what are the 5 cornerstones to ophthalmology performance. And we'll talk about patient experience, operations, finance, clinical, and then employees and staffing. So with that, let's jump right in and kick into the patient experience area. And within patient experience, we thought we'd just start right out with what are some of those, KPIs that you're probably measuring. Most organizations are, but we try to list out here, and number 1 on our list was, patient satisfaction scores, whether you're using a general measure of patient satisfaction or you dig down a little deeper. The 2 that we really like are would the patient recommend the physician and would the patient recommend the practice? So these are some key KPIs we want to be talking about. And of course, in other areas, we also want to be talking about online patient reviews.
Yeah, so online reviews, it's really important to be looking at these. And this is one where we want to be able to understand what's being said about us, not necessarily through our surveys, but what's being said about us on places like Yelp and Google and Find a Doc. And so being able to understand that is really important as well. And once we understand these satisfaction terms, we also kind of want to dig into what's really leading to our patients' perceptions about our practice. And of course, one of the big ones is how quickly can patients get an appointment? We want to understand the booking lead time and how long it takes to get in to see a provider.
Yeah, and then the last sort of key KPIs we're going to talk about is the time spent waiting, looking at your cycle times. How long does it take from when you walk into the practice to when you would get put into a room, and then how much time you spent with the physician, and even how long was your total visit in the practice. So those are some of the key KPIs, but let's dig into a few of them and go a little deeper. Scott, what do patients really want?
Yeah, it's really interesting because you think as a patient, when I go see a physician, it's because I've got a problem, it's because I hurt somewhere, and I want good outcomes. And of course, we do want good outcomes, but as you dig in and look at the surveys themselves, what's really interesting to find out is what really drives the patient satisfaction is customer service. It's how they're treated by the provider, how they're treated by the staff while they're in the clinic. And that really drives patient satisfaction quite a bit. It drives it in the scores that they give to us. It also drives it really on the online reviews. When we think about these online reviews, we think about social media and what happens in social media, and of course people are going to be more likely to share negative experiences than they are positive experiences. But when it comes to places where they're actually giving us ratings, it's really important for us to be able to go in and see what they're saying so that we can correct what's out there and so that we can promote what people are saying that we do very, very well. And I know we think that online reviews we don't have a lot of control over, but they're very important from a competitive standpoint. There was a survey done recently by Press Ganey that showed patients read about 5.5 reviews before they select a provider, and most patients by a large margin will not select a provider even if they're referred if they have less than a 4-star review. I thought that was very, very interesting. But when you really dig in and see what they're saying, customer service is the most important factor that influences loyalty to a provider. And so customer service is where we really want to start digging in and making sure we're doing a good job of that. And by doing that, we probably want to look at what people are telling us directly in the surveys that they give to us.
Scott, you bring up some great points about customer service. When I go to the dentist, they're very focused on the patient experience, probably more so than other organizations. And because of what we do here at PDS, I usually end up talking with one of the doctors about that. But one of the things that impresses me so much is whenever they call me just to bring me in, the first thing they'll say is, "Hi, my name is Sally," or "Hi, this is Joe. I'm going to be working with you today." And that always impresses me that they take that extra 30 seconds to introduce themselves and give me their name, because really it makes me feel important as a patient, these kind of little things. Here's an example of a dashboard where, best practice organizations, we talk about what are some of those KPIs that we might want to measure. And here you can see reformatted patient experience data presented in a way that you can't miss. If our goal is to make sure that our patients are recommending the physician or our group, you can't miss this. And then on top of that, we're using this sort of slided scale bar chart that when you're way above or way below, you really can't miss that. At the group level, at the practice level, we've got some issues with communication on the phone and scheduling appointments. But if you look over here on the right, overall, the person's fairly, the patients are fairly happy with the physician. So it's a great example of a visual dashboard, really making it easy for everybody to see where do we need improvement and where are we doing well.
So the next cornerstone we want to talk about is in operations, and what can we do from a data standpoint to understand how we're operating and what can we do to make ourselves a little bit more efficient in the way that we run things. And so some of the key KPIs that we want to look at here are things like, especially in ophthalmology, we want to understand our procedure mix. We want to understand what's an office visit versus imaging versus surgeries, things like that. We want to make sure that we're assessing the diversity and specialization of the services that we're providing. Back to appointment booking lead time, how quickly can we get patients in? Patient access is absolutely critical from a competitive standpoint as well as from a practice operations standpoint. So in order to maximize that, sometimes we need to understand our patient no-show rate. We need to understand our provider utilization rate and how much of the provider's template is being utilized for patient care while they're in the office.
Yeah, and so a lot of these, first four metrics you highlight, Scott, I would hope most organizations have. Sometimes provider utilization is a little bit tricky to get out of sort of standard reporting tools, but it's really key to be able to see that booked versus available time. We're going to look more at that. Some other key metrics that, hopefully you're measuring on the operational side is looking at things like screening rates, how frequent are patients receiving preventative care, our surgical conversion rate, and typically not trying to measure how many went into surgery, but how many who could have surgery actually did then schedule the surgery. Our use of our retail services, eyewear purchases, lenses, and other offerings that we have. And then, of course, patient retention, which is a big one, and how do we track that, especially for younger patients who maybe are just using our screening and maybe moving around, but even looking at patient retention. And we'll talk a little bit about some of those metrics. So let's break this down a little further for everybody.
To really understand operationally what we're doing and get a better grip of how we can do things better, I think one of the biggest things we need to understand is the number of patients that we're serving. And the problem is there's a lot of different ways that you can count patients. I mean, we can look at a panel size, which is just a unique count of all of the patients that we've served. We may want to put time parameters on that, but we can do that easily. But then you get into things like, well, how many patient visits did we have and how many patients were new, how many patients were established, how many patients were technically established patients, but we haven't seen them in several years, so we're considering them new again. How many patients were referred by either other patients or providers? So getting kind of that count of the practice size that we're working with is really ideal to understanding how we can improve things operationally.
And then going a little further, we may need more definition or again, some more customized KPIs. What is a visit? Is it just one patient and one provider on one date of service? What is an encounter, right? We might have a patient who sees two different physicians. What is a case, especially when we start thinking about surgical cases and how we want to count those, and then even what's an episode. So having good definitions and being able to automate some of those metrics really, helping us understand what are we doing and then how are things changing, right? And so going a little further, if we may want to put them into some dashboards or some visualizations where we can look at breaking out surgeries, scheduled surgeries, visits, patients per month, and even just what are we doing, referrals. This is just an example of different ways you might want to start to correlate some data.
I think one of the big things that we see on this one is the new patient rate. I know we're looking at strategic growth in ophthalmology practices, finding patients that are new to the practice and working with them to in looking at retention rates and referral rates to better understand how we can find that strategic growth that comes in as well.
Yeah, and then even, going back to the patient experience, I like that we've got some patient sat metric right on the same page. So even though we're looking at volume, we want to make sure that we're not rushing patients through and sacrificing, providing good or quality service to them. Let's go ahead and take a look at a visual dashboard and look at some of the other metrics that we talked about operationally, right? And so this is an interactive visualization where, literally we can point and click, drag and drop, we can slice and dice through the data. We can start to undersee, what's going on just in 1 month. We've got things like looking at bump derived cancels, no shows, so we can start to see where and if we have a problem with one physician or one practice or one area, or are we maybe getting more no-shows on Fridays versus Mondays, potentially? So starting to understand that, as well as understanding the correlation between third next available and our appointment lag. And of course, right in the center of the screen here, we have that scheduling utilization. What is the available time of the physician versus the book time of the physician? So if we see we have a lot of availability, yet we've got patients waiting, whether it's long appointment lags or long third next available, we may operationally have some issues that we need to smooth out.
Operationally, we also discussed the need to understand the service mix that we're providing. And so we want to understand, what are the top procedures that we're doing that maybe, not necessarily our laser surgeries, but other surgeries that we're doing, or office visits, things like that. We need to understand what's our procedure versus our office visit mix. And then, of course, we may want to get a handle on, our retail services like we talked about before, that this is something that is unique to ophthalmology, where we have these retail services with the eye brands that we're offering with the prescribed lenses. And, how many and how frequently are people utilizing our retail services versus taking the prescriptions and going elsewhere?
Yeah, the other thing, Scott, I think that's just critical is if you do a lot of elective or cosmetic type procedures, really being able to track and trend those because they can have a real impact on profitability versus, say, just straight clinical procedures. So again, you see a little breakout here, but being able to dig in and go through that data so you really can see trends and understand what's going on. Those are some of the key metrics you want to have.
Right, and I think another key one here is the point of service collections, particularly for our cosmetics. How many are we getting ahead of time? How many are coming in, that are being financed or whatever? How well are we doing in collecting patient responsibility at the time of service versus having to collect it on the back end. And that really goes to kind of strengthening the bottom line of the practice. I know a long time ago when I was in business school, they talked about if you're trying to grow revenues or strengthen your bottom line at all, there's three ways you can do it. You can either increase volume, or in our case, we can see more patients. You can increase your prices or improve the reimbursement like we do in healthcare, or you can get paid faster. And I think that's one that people don't pay a lot of attention to. But strengthening the bottom line is really key, because in order to have a practice, we need to be financially viable.
Yeah, and so we really moved from, patients and what I consider operations into finance, Scott, which is what you're talking about here. So let's break down. Obviously, there's some real key metrics to strengthening our ophthalmology practice, but let's talk about a few of the key ones.
Yeah, I think the biggest ones we need to look at, our revenue per patient visit, and really understanding, again, that comes into play with the service mix that we're getting. But that's a trend that we definitely want to look at, is that revenue per visit. In addition to that, payer mix is important, especially in ophthalmology, where we have so much that does fall into self-pay, but we also have a lot of Medicare, we have a lot of Medicaid. We really need to understand that payer mix that's out there. And then our collection ratios, how well are we collecting what we're entitled to collect, and are we doing a good job of getting it on the front end or the back end?
Yeah, and going a little further, right? If our collections are slow, what's in our days in AR, and how is it changing, and where are we seeing challenges, especially with particular payers or particular service lines? And directly related, what about our denial rates? And because our denials could be impacting our accounts receivable, but also then being able to track denial recovery rates. Really key here as we move forward.
Yeah, and we discussed a little bit earlier that point of service collections, prepayment collections, those are really key in an ophthalmology practice, of making sure that we're getting those as much as we can in advance from our patients. But then we also may have patients who are on payment plans or receiving financing, and we need to make sure that we're monitoring those payment plans and making sure that our patients are being compliant with those as well. And then, of course, we need to understand, surgical cases. We may want to set those apart from our office visits, and then our imaging and things like that as well, and just look at, what's being generated from a revenue standpoint from our surgical cases, to understand the proportion of our total practice revenue.
And then, certainly our retail sales component we've touched on, being able to understand, what are we doing, what percentage of patients are taking advantage of that. And then ultimately, even then our practice overhead, not only for our retail business, but on both our clinical and our cosmetic side. And, being able to understand expenses by office, location, service line, so we can both monitor and then cost control.
So if you look at another visual dashboard, this is one that focuses on the finance that's out there. And we have, payer mix information like we talked about before. We can look at our charges, payments, contractual adjustments, days in AR, and even look at some denial trends that are out there. We can look at our matched collection rate and our reimbursement. How well are we collecting what we can get paid? And then, when we talk about getting paid faster, we have the average charge lag that's up there to look at as well. I think this is just kind of key to see the trends over time, see how our volumes are working, and then, of course, paying attention to our payer mix and seeing how it may be changing over time as well.
Yeah, and so what you don't see on this financial dashboard is RVUs, and I know some ophthalmology practices, they use more the, eat what you kill model, that, collection revenue based model. But RVUs really, if you're not using them to manage, even if they're not, forefront in how you're running your organization, there's several different areas that you probably should be in thinking about RVUs.
Yeah, and RVUs are something that we work with clients very differently throughout the country, where people want to measure RVUs a little bit differently. We may have to do some variations in the calculations than what may be different from coming out of your billing system. So obviously the CMS annual RVU updates come into play. We make those calculations every year. But sometimes people want modifier adjustments attached to those as well. And those can be different by practice, even by payer. They may want some contract specific variations, pseudocodes, unlisted codes. Those are big ones where those may not be in CMS tables. And so the practice has to assign those out and map those in. In addition to that, they may be using benchmarking services, which calculate RVUs a little bit differently. They may have compensation plans that calculate RVUs a little bit differently. So making sure those RVU calculations are where the practice needs them. And many times what we've seen with our clients is that they utilize multiple RVU calculations in their reporting.
And just going a little further, Scott, you touched on a lot of these, right? Thinking about the reimbursement per RVU so you can start to benchmark some of your different key payers. This is a interactive visualization. So if I were to click on Blue Shield, you'll see the data starts to change. But we can really benchmark how the different payers are, not only reimbursing us, how quickly we're getting paid, starting to understand even our denial rates and where if we have a lot of denials, but we're not recovering those denials, I unfortunately, then we're really losing revenue as we go. So, being able to have the tools to be able to point and click and drag and drop and slice and dice your way through some of those key metrics is just critical to where we're headed. Let's talk about time to payment, Scott. You mentioned, charge lag and charge lag delays. What is the real impact to the organization?
Yeah, this is the one thing that we talked about with getting paid faster, that while we provide the services, a lot of times there are dollars that are just tied up in the system based on how quickly can we get our charges in, how long does it take to put them into the billing system and drop to a claim, how long does it take our payers to pay us, and how long does it take us to collect the balances on the back end. And so all of that is dollars that are tied up that are not being able to be used strategically through the practice. And the way I like to look at it is that if you can shorten any one of these by 1 day, that year you will collect 366 days worth of payments rather than 365. And of course, if you do multiple days, then that's just more days payments that you'll receive throughout that in the course of that year. So shortening these time frames as much as you can really help strengthen your bottom line in terms of what you're actually putting into the bank every week.
And going a little further, if we look at the impact of denials, being able to understand our denial rates and then our appeal success, right? If we're not able to successfully collect on those denials, that's really lost revenue. And so being able to understand where we're recovering and where we're not recovering is critical to maximizing, our reimbursement.
The next cornerstone we want to talk about is the clinical cornerstone. This is where we start looking at outcomes and how well are we performing in providing excellent care to our patients. And so a couple of the key KPIs that we want to look at from a clinical standpoint are, compliance with clinical guidelines, the best practice throughout the nation. These are things that every provider should know, but making sure that they're doing things like doing timely follow-ups for patients with chronic conditions, or looking at actual measures that come through, such as success rates in cataract surgeries, LASIK, glaucoma treatments, things like that. So really trying to get a handle of the quality that we're providing within the practice.
And then related to our clinical outcomes, of course, do we have any complication rates? And, how are we performing, with any complications or post-surgery follow-ups that we might want to be doing, and being able to, track and trend those to make sure that things aren't changing, in the wrong direction. Finally, thinking about payer, what are the payers reimbursing us on? What are some of the quality metrics that may have incentive payments that we can maximize by making sure we're focused on them?
Yeah, and I think one of the difficult things about measuring quality is that they can, there's not necessarily defined metrics that are out there to look at. So a good place to start is MIPS metrics. Those are places where you can determine, how well you're performing in certain areas, like providing ongoing care for diabetic retinopathy or open angle glaucoma treatments, things like that. Looking at these defined metrics that have come through CMS, through Medicare, or looking at even payer defined specific metrics, and then tracking how well are you performing from a, practice standpoint, as well as looking at individual providers, who's meeting the threshold, who are the providers who are not necessarily meeting the threshold. And then, of course, maybe focusing on a couple of very key metrics, like, again, patient experience, patient satisfaction, which is one that a lot of payers look to from a quality standpoint, as well as looking at, something like how well are we managing chronic eye disease and things like that, the number of patients that we're seeing in those areas. So just providing a quick glimpse of clinical quality can really be beneficial to providers that we're working with.
Let's talk about the fifth cornerstone, which is our employees, our staff, right? So some of the key metrics that we've helped organizations with, engagement. How do the employees and physicians and staff feel, committed to their work and the practice? And on also tracking our turnover rates, when employees leave and the stability of things.
Yeah, and those turnover rates are really key, Russell, because we have a provider shortage and a nursing shortage right now, which make it difficult to replace those, which increase our recruitment costs, and that's a large cost to organizations these days, where it's not even just what's it take to recruit, but you have signing bonuses and things like that you have to work with to bring on new employees. And so really retention and engagement are key. Educational opportunities for our employees can really help improve engagement as well, and make sure that they're satisfied with where they're working. And then these aren't necessarily employees, but these are ones that we want to make sure are engaged and happy with the practice as well. These are our referring physicians, and we want to make sure that they're happy with the care that we're providing the patients that they're sending to us as well.
Speaking of employee engagement, there's numerous studies show that if the employees are more engaged and feel great about where they work and their role, this will drive up the patient experience scores. There's been numerous studies, and there's just a direct correlation between employee engagement and patient experience.
Yeah, no, this is true. And so when we start looking at metrics that look at patient or employee engagement, we can do employee engagement surveys. We can measure that and look at, again, questions just like we would patient satisfaction or patient experience. But we can also look at things like we talked about before, turnover rate, which is really a key one. If we want to look at engagement outside of that, we can look at different disciplinary actions that have been taken, but also understanding, what are our recruiting costs, making sure that those are in line, and making sure that our staffing is at the levels that we need it to be in order to provide care for the patients that we have, and create sustainable growth as well.
Scott, you also mentioned, we're talking about employees, but referring physicians. And if we are, an ophthalmology practice, part of a bigger health system, we may want to be able to look at, where we're getting referrals in from different specialties within our organization, or, even just from other areas or practices if we're a private practice organization, and understanding who is sending us patients. Even the payer mix. I've been asked this question, and we've been able to help organizations. I'd like to know who's sending me patients, but are they sending me good patients? Or are they, potentially sending me all the Medicaid patients, et cetera? And so being able to understand who's referring physicians and what kinds of services. So having, good analytics and data to be able to understand not only what's going on, but how is that trending? Are referrals down? Have we changed our marketing efforts or something? We really need to be able to focus and understand the impact.
Yeah, I think those trends are something that we definitely need to concentrate on. And of course, looking at the different procedures that we're working on. If we see a lot of procedures that are being referred to us by other physicians, those are ones that are probably our most marketable services. And we really want to make sure that we're promoting those both to the physician community as well as to the patient community at large.
So, how do we start tying together these different cornerstones? Because you don't just focus on patient satisfaction, or you just don't focus on operations, right? And so, what you're looking at here now is where we're looking at our physicians' performance all blended together. And you'll notice we might have set a benchmark for RVU performance. We can look at how the physicians are performing in each of our different locations. This is an interactive visualization, so it's fairly easy if we just want to see where a physician's not, potentially hitting whatever our internal target is. The data will point and click. But I also want you to notice we're looking at things like charge lag of physicians. What is their coding level? And of course, even the patient satisfaction scores. How do the patients feel? So we can very quickly see, you know, who is potentially, below 90% on ease of scheduling, which offices are we having trouble with? And then even, are there physicians though that aren't quite performing and we're still having trouble with both the patient satisfaction and getting the data we need. So as we start to tie together metrics, this is where these interactive visualization tools like Power BI and Tableau can really become more valuable in exploring data to understand where those outliers are.
So when we think about this strategically from an analytics standpoint, there are lots of things that we need to consider based on the data that we need to be able to pull, and can we optimize that data? And really, when you think about it, the tool on the back end isn't nearly as important as the data that it's sitting on top of. Is it optimized, and is it easy to be able to pull the data in order to put them into what we like to consider the analytics trio, where we have the high level visualizations that is really good for providers and executives to notice quickly trends and spikes and things like that in our business. But sometimes that generates a lot of questions that we may want to go into cube type reporting, where we're able to go in and slice and dice very quickly in order to look at apply filters and calculations and really see what's going on a little bit better. And of course then getting down to the detail level as we need to as well, making sure that we can do that seamlessly and provide this access to data across a large level of the organization is really key from a strategic standpoint.
Yeah, Scott, the visualization and we were just showing visualization tools is sort of the most popular area right now. Everybody's thinking about tools like Power BI, Tableau, Click, MicroStrategy, even, SAP. So visualization tools are great. And there's such a focus right now. Everybody's sort of building visualizations. They're great to understand data, explore data. And, your dashboards can really tell a story. What's key though, and a lot of people miss, is that those other two areas, Scott, I'm going to just jump back to that other slide. When the visualization shows you where there are challenges, if you don't have an easy way to just point and click or to do that patient level reporting, who are all the patients that haven't been back for screenings? Or who are all the patients that maybe we're not hitting our clinical guidelines on? And to be able to do that detailed level reporting oftentimes is not so much in the visualization. So having a good set of tools that can allow you to have all the information at your fingertips is really where organizations need to think strategically when they think about analytics.
And so these visual tools really are critical in providing our physicians with the opportunity to see how they stand in each of these key cornerstones from a productivity and quality standpoint. They want to be able to self-manage and make sure that they're providing the highest level of care possible. But in addition to that, physicians are ultimately concerned with their compensation as well. And so a lot of times what you see in practices is that these are two very siloed reporting type processes that are out there, and they really shouldn't be. Really, the two should be kind of intermingled quite a bit because they tell the same story. We want our providers to be able to see the things that help to get their compensation where they need it to be, but also help them self-manage from a quality standpoint, from an operational standpoint, and from an overall patient experience standpoint as well.
And so, Scott, as we look at a physician dashboard, right, we may want to focus in, what is that? Is it revenue driven, volume driven appointments? You'll see, again, tying it all together, these patient satisfaction metrics. So the physicians really can understand how are they performing from a productivity side. But ultimately, then, when we start delivering their compensation reports, we may want to show some of those same productivity metrics. So here on the left side in our comp report, we've got, what is the earned comp and how that's driven through cash. But on the right side of the screen, we've got some of those same metrics that we're showing them, monthly or weekly in their productivity reporting.
Right. And I think a lot of these are really critical because, when they look at them, those supporting metrics that are over on the right-hand side are really driving what they're seeing in terms of uh, the compensation calculations that are coming on the left. So it again helps them to be able to see what modifications they need to make in their practice patterns or things that they're doing in order to get up to the compensation level that they want. But it's also helping to improve the overall profitability, feasibility, and operational efficiencies of the practice when they do so.
And so, what we've really been talking about here is how do we use analytics and dashboards to both drive performance improvement, measure where we are, and then ultimately drive better, you know, better performance, satisfaction. And so what you've seen in the last couple examples is what we consider the higher levels of analytical intensity, where we're now setting benchmarks, we're setting targets, and we're building relationships between, productivity, RVUs, patient volumes, and then ultimately the revenue generated. Ideally, what we want to be able to do is we want to be able to project what if we could improve? What if every physician could improve by 5%? What if all the physicians performing below, let's say, our internal benchmark could improve? And there's a lot of different places that we can get benchmarks, but ultimately, what we really want to do is we want to use both internal or external benchmarks to understand where we are to see if there aren't opportunities for performance gains.
Yeah, and this is something that can be difficult in a practice sometimes when you start incorporating benchmarks and you start doing comparisons this way. But really, when you look at it, providers that are underperforming from a productivity standpoint are an opportunity, because if you can get the providers who are at the lowest levels, not performing at the 50th percentile of the specialty mean up to the average, and if you can take those that are at the average and help them to increase a little bit to become up to the 65th, 75th percentile, there's going to be huge financial and operational gains every time you can get that improvement. And so working with just a handful of providers and helping them move up to the average really can find areas of improvement in patient access, in appointment wait times, in patient satisfaction or patient experience, and of course, overall financial performance of the practice.
So let's actually look at a visualization that is calculating the projected performance improvement. And this is, to me, kind of the fun part about data and analytics, right? So here we're looking at all of our different physicians and we've stratified them, just like in the example Scott was just speaking to, where these are how many different visits per 4 hour session each physician is seeing. And so, as you can see, we have some physicians above our average across the practice. And we have right here, these are the physicians that are performing below the average. And if we were to just highlight those physicians, we're able to use our analytics to calculate if I can move any one of these physicians up to the average of our practice and how many patients are seen. Calculating them, we know the revenue per visit. And we talked about that as one of the key metrics. We can actually calculate what is the performance improvement to the physician or to the organization. And so this is kind of a higher level usage of analytics where we're not just saying what are we doing, we're saying what if we improve, what is the impact? And being able to share and sort of showcase some of this information really can drive significant performance changes, especially when you think about physicians and their comp, right? So we want them to be successful. We want to be optimized. And so it's kind of tying all the different pieces together to effectively tell the story.
And you know what's the beautiful part about this one, Russell, is that when you're using internal benchmarks, the mean is a moving average. So as you move these providers up, the mean moves up as well. And you're always going to have providers that are below the mean. So you'll always have providers you can keep working with, and this performance opportunity is always going to be there.
Right. So, I challenge you as you've watched this webinar, we've talked about a number of different metrics. And, oftentimes I hear, well, we can get to a lot of the metrics, but can you get to them quickly? Right? Do you have the right ophthalmology metrics and can you get to them quickly in a timely fashion? And then when you see a challenge within the data, if you've run a bunch of canned reports, so you've had to spend a lot of time in Excel, can you drill down very quickly? Can you go click, 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 and start to understand why is our days in IR so high? Where are we seeing denial rates? Where are we getting denials and never recovering? Can you quickly get to the detail? What's actually going on at the detailed level? And ultimately, then, does all of management have the data at their fingertips to be able to understand where are the performance areas of our organization and where are those performance gaps, as we were just showing you? And so I ask you, consider, can you evaluate how effective is the reporting that you're using today?
And then you need to understand, when you have access to the data, are you communicating it effectively? Are you getting the providers the information that they need in order to improve their performance and productivity? Does the support staff have the information that they need in order to help the providers reach their goals that are out there as well? And then, of course, are we aligning our compensation with the organizational goals that we're working with as well? And then, are we doing this in a timely fashion? Is it something that's only being done quarterly? Is it something that's being done monthly? Is it something that's being done throughout the month as well, so that we can really get timely and automated information available to the people who need it in order to better manage the practice and provide the best care possible to the patients while also remaining financially viable?
And so, to summarize, we've talked today about the different cornerstones to ophthalmology performance, and I appreciate you joining us through this little journey we've shared today. I do want to, point out that if you're weak in one area, or you're struggling with reporting, or you don't have the efficiency, the automation, or just access to the data you need, that Practical Data Solutions, we'd be happy to discuss with you the challenges, and could probably help you bring solutions that would help you overall with your organization, your performance, your growth, and whatever your strategy planning is.
So this time, we'd like to give you another opportunity to chat in any questions that you may have using the Q&A toolbar, and we will stay online until we've answered all of the questions. If you have any further questions, please feel free to contact us or visit our website, and we'd be happy to answer any questions that you may have, or have a discussion with ways that PDS may be able to help you and your organization. We also have other webinars available on various topics on our YouTube channel, so please feel free to join us there. We appreciate your time today and hope to see you on future PDS webinars.
Thanks, everyone.